Good morning, everybody. Good to see you again. We were expecting that today being the second day, there would be much less attendance, but I am thrilled to see that there are almost as many people as there were yesterday. I'm going to try and make my presentation as brief as possible because we've had some excellent insights from our colleagues Regina and Sanya. Thank you very much. My presentation is a little bit of a follow-on to their presentation. I just want to start by saying that the question of quality has been discussed for many, many, many years. And yet, if you were to ask somebody, so tell me, what is the quality of your preschool system? The answer you would get is, like that. Because we really do not have a simple, easy-to-report way of talking about quality. So why are we going on and on about this business of quality? It's not just the International Step-by-Step Association or the Step-by-Step NGOs who are questioning the whole area of quality, who are thinking about it, who are producing tools, who are producing concepts and ideas and frameworks. Many agencies are involved in this. And I will quickly run through what the different agencies are saying about quality in early childhood education, and then come to what are some key themes. Do you want me to put it higher? Okay. So why is this business of quality so important? Well, basically, quality is key to producing good child development outcomes, and I think we all agree on that. But it also, good quality tells us that if these outcomes are being achieved, it means our resources, the resources we are putting into early childhood education, are being used effectively. Now, poor quality, there is some research which shows that poor quality programs can actually lead to some negative outcomes in the social development, language development of children. A big concern for development agencies particularly is that of equity. And equity doesn't just mean access to programs, it also means access of both children from higher income families and children from low income families, children who are marginalized, children who are vulnerable, their access to good quality programs. And for UNICEF particularly, we feel that if children from low income backgrounds, children from marginalized backgrounds have access only to poor quality programs, the risk is that the gaps between their better resource peers and them will actually widen. And this is something that we absolutely want to work to prevent. Finally, the whole question of quality. What is quality? What is this thing called quality? Quality is an aspiration. Quality is something that we want to achieve. It is like perfection. It is something to be pursued. But at the same time, we know that we can also have some minimum standards of quality, a floor for quality below which we don't want our early childhood education systems or our early childhood education centers or services, we don't want them to fall below these minima of quality. So before I go into how quality is being discussed by the different agencies, by different groups, I just want to quickly touch upon some risks of the whole question of high standards of quality. Of course, as we know, sometimes high standards of quality can be very costly to implement. And if families have to pay for high quality services, this often tends to leave out the children of the poor. And high costs can sometimes also result in freezing access. Government saying, sorry, we cannot expand this service because it is of such high quality and the standards are so high that we can only concentrate it on a certain limited number of centers or places. So I think the whole question of quality is a little bit of dance between what are the resources, what is effective and good quality practice, and how we can achieve those minima without taking the price of services too high. So recently in UNICEF, we've been looking at how our colleagues in different organizations, different agencies are thinking about quality. USAID has recently come out with a document on quality, and they talk about designing effective education programs for early childhood development, and they talk about principles of good quality. And they include setting standards, maximizing cost effectiveness, starting with the most marginalized, community involvement, building on community strengths, focusing on transition points, and collaborating with other sectors. The EU, we talked about the communication on early childhood care and education from the EU. What are they focusing on? They're focusing on staff competencies and pedagogical practice. They're looking at competence requirements for staff, pedagogical orientations, regulatory frameworks for early childhood services, and child development outcomes. OECD, they have just recently produced a report called Starting Strong 3, which is entirely devoted to the whole question of quality. It contains a number of tools, and they talk about policy levers to encourage quality. So they talk about quality goals and regulations. They talk about designing and implementing curricula and standards, improving qualifications, training and working conditions, engaging family and community, data collection, research, and monitoring. Okay, we have the Global Monitoring Report, which talks about quality again, and for them, in early childhood education, regulation of program quality is important, focusing on child outcomes is important, and staffing policies are important. A group of researchers from the US, who I will call the Beyond Child Indicators Group, and our colleague Pia Rubella Brito was one of these from Yale University, who collaborated with Harvard and a research group called Mathematica. And they talk about the dimensions of quality, and they talk about dimensions of quality across different kinds of early childhood development programs. And the dimensions they identified were the alignment and emergence of programs from community values and principles. They talked about resources, the level of resources and their distribution. They talked about physical and spatial characteristics of the sites where programs are actually delivered. They talk about leadership and management, and they talk about interactions and communications. I would love to go into slightly more depth, but I'm afraid we don't have time. What I have done is on every slide, I have provided the web link, so if you should want to go and look at these materials in greater detail, you can do so. Quickly then on to a more recent effort from the World Bank. They call it SABER or SABER, which stands for System Assessment and Benchmarking for Education Results, very impressive sounding name. But they talk about policy goals, policy levers, and outcomes. And for them, measuring and assessing quality is, again, a very, very important dimension of their work. I have very intentionally not included ISA's work over here because you've given us a very good appraisal of the work that you're doing. Now, what is UNICEF doing in all of this when there is so much thinking and so many tools available? What are we doing? Well, basically what we want to do is we want to bring all these different strands of thinking into one available space where when countries are looking at their early childhood education systems, they can have all the choices that are available to them in one space. What we want to help them do is look at not only what is happening in the classroom or at the community level, but look at what is happening at the macro level, at the national level, so that we can answer the question, how is your early childhood education system doing? And we can also answer the question, how is the center in so-and-so village, in so-and-so district, how is it performing in terms of quality? So we want to scale these two levels, and we also want to look at what is the thinking, what are the tools, what are the dimensions, what are the features of what would comprise good quality. Again, we don't want to impose any ideas of good quality. We want to build on what exists, and we want to support governments to work with a group of local, national experts to be able to decide for themselves what they would include in a framework of what they consider to be good quality or quality that needs to be aspired to. So this group, which we would call a community of practice within the country, would talk about what are the standards, where are we, what are those strategic indicators of the different dimensions that we have identified of what defines quality at the system level and at the center level. Again, we're trying to be quite limited in our scope because we think this is a complex question. So we are trying to look at early education centers, and we're trying to look at the age group 3 to 6. Of course, we do know that there are many, many, many expressions of early education programs, many expressions of early childhood development programs, and of course, all of them have aspects of quality which need to be measured and monitored. But at this point, we feel, let us perfect in one slice of the big pie, and then perhaps we work outwards from that. Now, we feel that we don't want to measure quality just for fun. We want to measure quality because we want to monitor it, and we want to monitor it because we want to keep improving it on an ongoing basis. This slide I just had was the recurring themes that come across in all these different ways that people are looking at quality. I'm not going to go through these various points, but just come quickly to our whole concept of this community of practice that I talk about. So while at national level we think we can convene groups of key stakeholders, experts, professionals, counterparts who can actively engage in the whole question of quality, we also want to then articulate a more regional, with the support of our key partners, a more regional expression of what should this framework, broad framework of quality be, of what is happening in the bigger environment and what is happening inside the classroom. So just a quick definition of a community of practice, what is the goal of a community of practice? It is, in this case, to improve the quality of early childhood education services in CCIS by providing a forum for collaboration, knowledge sharing, and coordinated action. And just to give you a definition of what is a community of practice, a community of practice is really a group of people who share a common concern, a set of problems, or are interested in a topic, and who come together to fulfill both individual and group goals. Communities of practice often focus on sharing best practices, promoting peer learning, and creating new knowledge. And the idea is to connect people, enable dialogue, stimulate learning, etc., etc. So why are we doing this? Because we have frequent requests from people we are working with to support the monitoring of early childhood education services. We find that many countries are drafting plans. There are new and different kinds of models of early childhood education. There are community-based models. There is the grade 0. There are half-day programs. There are full-day programs. what are the essential ingredients of quality that we want to be able to capture at national level and be able to say, we are below the level we want to be, we're at the level, we can improve, or we are actually performing well beyond what we hope to do. So basically, this is something I've already said. We want to look both at systems and we want to look at centers. We want to look at systems in terms of governance, in terms of financing, in terms of the workforce, in terms of teacher qualification, in terms of teacher skills. We want to look at curricula, etc., etc. The last slide actually summarizes what this community of practice will be. We are thinking about national level community of practices which communicate one with the other, but also communicate at a regional level. And we hope that all these communities of practice are supported by global and regional expertise. So I will end there, and if you have any questions, maybe we can discuss them later. Thank you.